My question is, what make people healthy? Which are the health promoting factors? And how is possible to feel quite well, even though a person has experienced trauma? In the healthcare design, we're looking for the psychosocial factor. We have developed a lot of research. And the major research that is relevant internationally, globally accepted, salutogenic design. When we design very complex building like hospital, like many other complexity, we don't ask public scientists or psychologists, sociologists, other discipline as architect to understand how interaction between people and the environment could work and compatible with their need. My name is Dilani from Stockholm, Sweden. I am very pleased today to present my research, which is the result of last 40 years of my life work. I am architect. I went to medical university and I did my research on design and health and the impact of the built environment on health and well-being. When I start my lecture worldwide, I started always with this slide to show 50 healthiest country in the world. This is very important. Why and how we have identified 50 healthiest country in the world and how other country health policy to allow them to reach to be among 50th healthiest country in the world. As we see, the country like Italy with medium age of 93 years, number one, and later Spain and Switzerland is among top healthiest country in the world. And as you see the number, Italy, Iceland, Switzerland, Singapore, Australia, Spain, Japan, Sweden, where I live, is number 8 among healthiest country in the world. This list show us what is the reason behind those, why some countries healthiest and some not. As we see, United States in this list is number 34. Despite spending 20% of GDP, but still is not among top countries, healthiest countries in the world. While European country, Sweden, is among those countries that public health, public funding health system, they spend only 10%, 9%. They are top in the world. And countries like Singapore, they spend only 4% of GDP, but they are number 4 in the world. This shows that United States, despite of all technology, all knowledge, hospitals, doctors, drugs, industry, still they are not good health, and with 20% spending of GDP. This is a big question for Ministry of Health around the world to look at. Why other countries health system that spend less, but they are healthiest? And that's the reason we are going to discover in this lecture. We show the countries like Italy is among top healthiest in the world. In this slide shows despite of struggling economy, but they are top in the world because of the lifestyle. This shows the environment. People sitting in this area with healthy nutrition, healthy food, climate, no stress, it provides good condition for health. And that is the main reason that how architecture provide promoting health of people, but also how to prevent stress. That is a crucial. We looked the World Health Organization and statement in 86. They said, health is created and lived by people within a setting of their everyday life where they learn, work, play, and love. This is very good statement. But also said health is created by caring for oneself and others, by being able to take decision and have control over one's life circumstance, and by ensuring that the society one lives in create condition to allow the realization of health by all its members. So shows clearly that the condition in the society that provide health for people. This is very important issue, that government provide condition for people in order people can promote their own health. And World Health Organization also mentioned on the global action plan that to reduce modifiable risk factors for non-communicable diseases and underlying social determinants through creation of health-promoting environment, which means non-communicable diseases, lifestyle-related diseases, is the main issue to promote health, which means highly depend on our own lifestyle in order to promote our health. But our lifestyles also depending the interaction with architecture, with the city planning, with the environment that we live, we work, we love. So 1997, World Health Organization identified health arena, including priority setting and frequently used spaces such as workplace, school environment, hospital, correctional institution, commercial spaces, offices, public spaces, and town and city, and indeed our home. It should be center of health promotion. That was very important statement by World Health Organization. And also in 66 meeting of General Assembly United Nations, for the first time, they mentioned that non-communicable diseases, lifestyles-related diseases, is the most crucial to prevent diseases and promote health of people's health. And Academy was the first time that in this assembly mentioned that physical environment could prevent lifestyle-related diseases. And architecture, city planning are crucial to prevent stress and promote health. Well, again, we look World Health Organization definition of health, that health is a state of complete physical, psychological, and social well-being, and not only absence of illness. So health is three-dimensional: physical, psychological, and social well-being. I said example here in Sweden, Mikael Ljungberg was Olympic medal, gold medal, when he came back to Sweden after 6 months, suicide and died. The world's strongest man has died just after 6 months. He got gold Olympic. This shows that the strongest man, but still very sick, and mentally, but also could be socially. So it's very important to have three-dimensional of health. Unfortunately, we have many researchers that socially they are ill, despite their knowledge, despite their ability be top researcher in the world. But many of them, I experienced during my life, that socially are not capable to deal with daily problem. And that means very crucial for us to always look health in 3 dimensions: physical, psychological, and social well-being. But also, of course, health depends on the social determinants of people and many individual lifestyles factor, social and community network, and how they live, the condition, etc. But first time, when I came to Karolinska Institute, I work on how to develop health theory, and we work with my colleague, Professor Christopher Konarski. Together we work, and we have identified health is a process. Health is a process and composed of psychosocial factor, lifestyle, emotion and experience, which create health and life. And equally, diseases is a process composed of psychosocial factor, lifestyle, emotion and experience, which lead to illness. So health is a matter of balance between these 2 processes. Health is a process composed of psychosocial factor, lifestyle, emotion and experience, and health and life create life. But also diseases is a process composed of psychosocial factor, lifestyle, emotion and experience, which lead to illness and to death. But there is also biological factor that could affect positively health process or negatively diseases. Health is the matter of balance between always these 2 processes, where we exposed to risk factor that bring us to diseases or wellness factor bring us to health, and this is state of well-being. If we are here always, it's good for our health and we can keep our health. So the dilemma is medical science focused here this part, and they have developed 8,000 diagnoses. If the medical science, they could equally focus on that part, they could develop 8,000 wellness factors, what make people healthy. So that's why we call the salutogenesis, the causes of health, and pathogenesis, the causes of illness, the origin of illness. And as we see here, emotion and experience is crucial for health and has a strong link between architecture, design, that could affect our emotion, experience, and lifestyle, positively or negatively. So that is first time that I have discovered the impact of architecture on health and relation between design and health. So we have our colleague in the United States mentioned, give me your address, I tell you how long you live. We have developed so long research that we can identify the location for health and diseases. So this is very important, and how we develop the theory of health. And just you say, through lifestyle, I am 63 years old now. I have never used any drug, never hospitalized, simply because I do exercise, I don't eat McDonald's, I don't eat junk food, and I never smoke. And I drink only time to time a glass of wine, not more. This is a crucial about the theory of health and relation to design. If you look the theory of stress, there is also shown very clearly the built environment. The built environment, the city that creates social organization, structure and function in our society, develops psychosocial stimuli together with psychobiological program, and develop a mechanism that we call stress and precursors, later precursors of diseases, and finally diseases itself. As you see, also stress is a process and happen through the interaction of people within the built environment, where we live, where we work. And this reaction could develop in long term to diseases, but also depend of genetical factor, earlier environmental influences, how people react. The things that is stressful for me is not for you, and vice versa. So the origin of health is coming from Aaron Antonovsky when he wrote Health, Stress, and Coping. And he developed the theory of salutogenesis. He was in concentration camp and he observed some people during the time they survived, but some of them not. Some of them, they suffered a lot, but still they survived with strong health, and some of them not. And that was a big question for him, why, despite the same pressure in the environment, some people survive and some people not, but some people have greater health. That was a big question when he left concentration camp and he came to San Francisco, University of Berkeley, and studied medicine, sociology, and he discovered the theory of salutogenesis and developed theory of health. Saluto means health, genes means origin, and is an approach focusing on factors that support human health and well-being. The theory of salutogenesis is contrast to pathogenesis, orientation of healthcare. He suggests that we shall look for wellness factor rather than risk factor. But also he was one of the first scientists in the world that he mentioned. Healthcare and medical science has focused for factors that cure diseases and factors that lead to diseases. So the theory of salutogenesis focuses on to guide to health promotion through healthy lifestyle by focusing on stress reduction, as well as coping with factors that causes stress. So how through our lifestyle we can reduce stress or be able to manage stress. So the theory of salutogenesis is an approach to health promotion, but also prevention. It's the characteristics that determine person's ability with stress he called sense of coherence. And sense of coherence have three components. Comprehensibility, world is understandable. That means whatever we do, we must understand first. And second, whatever we do, we must be able to manage resources to meet situation. And finally, must be meaningfulness. Life makes sense. Whatever we do, it must be kind of rewarding for our brain. And that is crucial for our health. So these three components we can measure. We have done a lot of research to measure sense of coherence of people in workplace, in different environment. What we have done at Karolinska Institute with interdisciplinary approach with sociologists, architects, psychologists, and other disciplines, we discussed how to link and how to integrate sense of coherence to the quality of architecture, the quality of built environment that are comprehensible, that manageable, that are also meaningful. These three components we have identified, we have developed within the architecture, in city planning, in office design, in elderly, in hospital. More our researches we have done in hospital is also relevant for other area, for other sector. And finally, for our home also is relevant. So we have published many articles worldwide and describe what is the wellness factor within the built environment that could be considered as health promoting and support sense of coherence. Social organization, personal control, light, color, music, all these wellness factors could be integrated with psychosocial stimuli within the built environment that we can feel good, but also strengthen our sense of coherence. We bring this design and health issue to the government. We bring to the parliament in Sweden, has been accepted 2005 as an act of design and health. But also recently, we have developed this translating salutogenic theory into environmental design factors that promote health but also prevent stress. We have quantified all those design factors within different projects. So this is an example that we have done for architecture that has been applied to most successful hospital in the world. Children's Hospital in Melbourne that has been applied this principle and is received 5 Academy Awards with this quality that we consider as salutogenic design, one of the most successful hospital in the world. And second one, that myself working with my PhD, with my postdoc, and for many years followed the hospital, is top in the world. For the first time, we design hospital different, that is manageable, that is understandable, that is also meaningful. As a city planning, we have integrated hospital within the urban planning. And that is how become the Norwegian Trondheim Hospital top in the world, received 7 Academy Awards. You can see, for the first time, we have knowledge center where we can learn about our health within the hospital and educate people how for healthy lifestyle. And also they can see when they come to the hospital, they can look for their health and learn about their diseases, how to prevent and how strength. And also kind of environment that 70% of visitors coming with bicycle. And that is also of lifestyle and use of art and integration of art and environment within the city as part of, integral part of the city, well integrated city planning, and with art, with nature, different center with different need of staff and patient, like center for children and women diseases is completely separate than others with different specialty, with different design need as well. This is the top quality of hospital in the world, and city belong to, hospital belong to the city, and we redesign the hospital as part of city with the best quality. So the salutogenic hospital means to deliver most appropriate medical services for patient in a very stimulating environment that support the healing process for patient and is experienced by staff and enjoyable and efficient workplace. Salutogenic hospital furthermore provides services that actively prevent people getting sick through the regular checkup to spot diseases by identify risk factor in early stage. The cost of medical treatment reduces and support healthier society. And finally, the Salutogenic Hospital serves its local community, its patient population, and its own staff through delivery of medical treatment and clinical services, providing in combination with preventative measure and public health information that promote health, well-being, and quality of life. This is the definition of Salutogenic Hospital. And as you see the picture, they received 7 Academy Awards. One of the most successful hospitals in the world. I go back to discuss about lifestyle-related diseases and non-communicable diseases. According to World Health Organization, one of the most crucial issues in public health and how we can reduce lifestyle-related diseases is the built environment. For that reason, I met several times with Julio Frank, the Dean of Public Health at Harvard University. He was, of course, he was former Minister of Health and very well placed how to deal with public health issue as Minister of Health from Mexico. He came to Harvard and became the Dean of School of Public Health. And that's, we discuss and we develop a strategy how to deal with that worldwide. And myself, I went to US Academy of Science and I discussed why, despite of 20% of GDP and all resources in United States has so high cost of lifestyle compared to public funding countries like in Sweden and Europe, public funding healthcare system that spend less but they have healthier. So I'm going to discuss this issue now and the role of built environment in this regard. I received, after my lecture at the US Academy of Science, later on I give lecture in several schools of business, School of Public Health, School of Design, School of Sustainability at University of Harvard. And after that I received the award from the American Institute of Architects for my championing intellectual honesty in research and on the built environment, and also pursuing uncompromising professionalism in my research area, which I mentioned why in the United States, despite of spending 20% of GDP with all hospital technology and science, still United States is number 34 in health index compared to European, Scandinavian countries that public funding healthcare spending 10%, but they are among top healthiest country in the world. Health, exercise and health is one of the main topic of lifestyle. Exercise prevents 91% causes of type 2 diabetes and prevent 50% of causes of heart diseases and 50% of all stroke deaths, reduce site-specific cancer by 50 to 72%. Exercise decrease all causes of mortality almost by 67% and prevent up to 47% of cognitive damage, decrease depression by 20%, and all accomplished by just 30 minutes of moderate activity each day. It's Exercise and health is crucial also for reduce of risk for dementia by 52% and reduce risk of Alzheimer's disease is 62%. And it's never late actually. Exercise increase the size of hippocampus and improve our memory. And this slide shows clearly those people that exercise, they increase activity, and left side of and right side of hippocampus in these two diagrams. So it is very important. Create environment that provide for people easy choice for exercise. So the choice environment, so that invite people come to the park and make a healthy lifestyle easier for people. If we plan like this, this is the central of Seoul in South Korea, people can easily come to this street and walk and safe. So easy choice for people for healthy lifestyle. We have applied this in prison design, we have applied for elderly, we have applied for a school environment. It's very important for the school environment that school have access to not only learning but also to play, for healthy eating and also sport. That is a crucial, and we have access, feeling good, safety and functional and comfort. So this kind of school that there is no corridor, that all spaces for kids to play and enjoy the environment. This is one of the schools that is in Sweden, in Stockholm, within a beautiful environment, in nature. And this is the place that where they go for sport, but also the corridor they use for exhibition. During the weekend they use for exhibition, and they keep the art during the week. And this all regarded by students during the week, and always is very safe. And here students learn about their responsibility, how to learn about the responsibility, to be responsible, and this is part of education. And when they eat in the best stimulated environment for them to choose healthy food and play as well. So this is a kind of application that we have we recommend worldwide for school environment, but also for elderly. We have applied this knowledge with several case study, both in Sweden and other countries. This is one of the that we have done in Hong Kong. Health promotion in elderly is crucial. We have normal aging, we have optimal aging. Optimal aging means simply how to keep your health as much as possible with functional, with all our resources that we have. But how to keep healthy is depend of daily our lifestyle. And as this diagram shows, we have biological health and chronological age. We can compare that. We can be calendar, we have two, like calendar age and healthy age. And this could be maximum 25 difference, 25 years different that we can keep our health. And through the exposure for healthy lifestyle. And you can see this slide shows the President of the United States while in office, exposure for stressor in the job make American president age more quickly, and that is correct. You more exposure for stress and job that require more responsibility, it affect our age. If we slow the process of aging by 7 years only, we can reduce all aging related diseases by almost 50%. So this is very important, how we can reduce or postpone actually diseases that are related to aging by our lifestyle. And this is very clearly shows that if we stop smoking, physical activity, social network, equality, income, education is very important, but also the quality of built environment. And the oldest 92 marathon runner is a woman. You can see how can run 40 kilometers. So this design and health application for correctional institution and prison we have applied, and still I am engaging. This year I am in the conference summit for correctional facility design development in Netherlands in June. I am discussing how to apply salutogenic design and prison. Most important, workplace office design, how to apply salutogenesis architecture in order to promote health and prevent stress. So with green environment inside the office, you are feeling good, welcome, but also clean the air and pleasant for the people. But also we can design the way that we can run, we can go, we can walk. These affect our condition, and we don't need to go to gym. So one of the offices that you can also go out, play tennis outside the office while you are working during the lunchtime. But also during the day, actually, you can play badminton in the office, but in the top you can work as well. So nowadays has been changed, the place of work, home, all integrated with post-pandemic. We should look how to design the workplace that really is well integrated with all those design factors. So 3 risk factors: lack of activity, unhealthy diet, create 4 diseases: cardiovascular diseases, type 2 diabetes, many cancer, and chronic lung diseases that kill 50% of world population. Architect, urban planning, and transport engineering, among others, can create an environment in which healthy choice are easy choice. And that is why we mentioned, so people obese, they spend 42% more than ordinary people for healthcare. And we need to come out of the box and ask questions. And that is Paul Robertson. He was psychologist and musician, that we work together how to bring music in health sector. Health is interdisciplinary. Health is not issue for medical doctors. Health is highly dependent on the responsibility of architect, engineer, musician, sociologist, psychologist, all other disciplines. Only together, all discipline, we can promote health in the society. So, my question is, what make people healthy? And that is crucial to ask everywhere. The salutogenic perspective dealing with what created health. Why is person well? Which are the health promoting factors? And how is possible to feel quite well, even though a person has experienced trauma? This is a crucial question of salutogenic perspective that we must have in every community, every society, every organization, every institution, in order to create health. We have developed this principle for the government of Australia. I did workshop, seminar with 6 states in Australia and central government in Canberra. And we publish a book, and we can see the question get modified and improve healthcare. What are the causes of diseases? It's a very important issue to change to health. What are the causes of health? How to treat diseases, how to prevent diseases. Change it to what contributed to good health. What makes keeping good health easier? And that is a salutogenesis. So we have applied this knowledge with Ministry of Health in South Africa. We develop competition, how to create health promoting lifestyle center instead of ordinary clinic to discuss lifestyle related diseases, non-communicable diseases, which means almost 80% of the cost of the United States related to non-communicable diseases, how we can see the same issue in South Africa and how we can prevent that. So we work as well with Singapore government, Malaysian government, Chinese government, here Australian, Vietnam, Hong Kong, Singapore, to discuss this issue and to apply this issue. 2017, after almost 25 years of my contribution to International Academy for Design and Health, I resigned and give the task to new generation. And here is the recognition, my work at the time by 3 ministers and government and mayor of the city and many colleagues. We give the leadership to the academy to new leaders. Gunther de Graves take it over, and I become as founder and first fellowship of academy. I continue my knowledge worldwide to spread this knowledge, to apply this knowledge. And now recently I applied this for housing in South France, this design factor, and created one of the most salutogenic, ecological, green, healthy environment for living. This is my project that I am working now. At the same time, I am trying to apply this knowledge in any other project if it's possible and educate new leader and discuss this issue. Thank you very much for your attention. I hope with this presentation I introduce you the crucial issue of design and health and salutogenic to you. Be well and good health. Thank you.